Hey y'all, my name is Jacqueline Weber. We are back today. I'm one of the midwives with CHRISTUS Trinity Clinic. We are currently in one of the OR rooms at Good Shepherd, and we have some fun guests with us today. They're going to talk you through if you did have a C-section. There's a couple reasons you would have a C-section. Maybe you've already planned a C-section, you never had one, or maybe you've had one before, or possibly you're in labor and things go wrong and you might need a C-section. So we wanted to bring you here today. We wanted to show you the OR. We want to talk through kind of what that might look like for you to make it less scary. And so I'm going to let my team introduce themselves. Also, just a couple maintenance things. If you could mute your microphones and leave questions for the end. We're going to ask you if you have any questions and you can type those in. And then also we are going to be unmasked today just for the purposes of teaching. So, all right, I'm going to let them get started.
Good morning. That was a genuine East Texas welcome with a hey y'all. So, hey y'all, good morning. Thank you first to Natasha and to Selena and our midwives for asking me to participate in this. It's nice to see some unmasked people. We're so accustomed to masks these days. One time I get to see a face is when I'm doing a virtual visit to our Zoom meeting. So I'm an OB hospitalist. My name is Keith Grisham. I'm an OB hospitalist here at CHRISTUS Good Shepherd. What that means is it's really unique and hopefully becoming the standard of care across our nation, because for the first almost 30 years of my career, typically when we are at home, when a patient comes into labor and delivery, a nurse does an initial assessment and they call the physician if it's after hours or if we're in our office. The beautiful thing about having an obstetric emergency department, which we have here at CHRISTUS, is that you have a physician on site 24 hours, which works hand in hand with the excellent nursing staff that we have here at CHRISTUS Good Shepherd. The question they asked me to address this morning specifically, I think, is the situation of a C-section, when we might do a C-section and what is involved with that. Some of the most common reasons for a cesarean section would be a repeat. So patients who previously had a C-section oftentimes have a repeat C-section. Sometimes they'll opt for a vaginal birth after cesarean section, and that's appropriate in certain situations, which your physician or midwife will often discuss with you. But that is one of the most common reasons, is just a repeat C-section. In those situations, the patient comes in and there's no labor room or anything like that. We just immediately prep you for going back to the OR for your cesarean section. The situations where you would have a C-section where you weren't planning one when you came into the hospital most commonly would be if you failed to progress, and that is you say would dilate to 6 centimeters and stall out and no longer continue to progress in labor. The second other situation would be if the baby's heart rate is not reassuring. In both of those instances, we have different parameters that we look at and utilize to decide whether or not we need to do a C-section. In the case of failure to progress, we have some additional monitors we'll put in to look to see if your contractions are sufficient to be causing the cervix to dilate. And if we're able to document that over a period of time, usually 1 to 2 hours, sometimes more, depending on the situation, how the baby looks, then we will look to see if those contractions are sufficiently strong, but you're not progressing, then we proceed with a C-section. In the case of a non-reassuring fetal heart rate tracing, two general categories with that. One would be an immediate issue, an urgent or an emergent C-section where the baby's heart rate drops down and does not recover. And the other situation, and probably more common, is a situation where the baby is showing a little more subtle signs over a period of time that would indicate that the baby is perhaps not doing as well or responding as well to labor, and for optimal maternal fetal outcome, we proceed with a C-section in those cases. So those are the most common. There are other reasons we do C-sections for abnormal placentation when the placenta is in a region where it's not safe to labor and other things like that. But those are the most common situations where we would have you come back for a cesarean section. Do you have other areas specific to that? Or?
No, we can go to Drew.
Very good.
Hi, I'm Drew. I'm a nurse anesthetist. I've been doing this for about 7 years now. My role in a C-section would be to keep you safe and comfortable throughout the procedure. The doctor's taking care of the procedure, the nurses will take care of your baby, and my role is to make sure you're safe and taken care of. I usually will meet you beforehand to discuss the plan, give you tips, that kind of thing. We'll come in here and I'll stay right by the head of the bed with you the whole time throughout the procedure, and then we'll accompany you back to your room where I pass you off to your nurse to continue your care.
Hi, I'm Rebecca. I am a labor and delivery nurse here. I've been working here for about 11 years and been nursing for 18 years. So usually here on the labor and delivery unit, we try to keep the same nurse throughout the whole process if we can. That includes admitting you as a patient, circulating your C-section, and then recovering you. When you come in to be admitted, or if you get changed from a labor status to a C-section, then there's some things that we need to do. We'll have some consents for you to sign, giving us permission to do all that for you. You will be getting some IV fluid, and we give a couple different medications for pre-op, including an antibiotic to help prevent infection. We are going to put some compression devices on your legs to help prevent blood clots. Everybody who has surgery gets those, and we generally put them on in the OR or right before you go back, and you're going to keep those on through your recovery period and into your postpartum period. We are also going to do a shade prep on your very lower belly. If you want to do that before you come, that's fine. If you're not able to get there or do it as well as we need it, then we'll do it before we go back. That's going to help the dressing stick better and things like that. I will be back here in the OR with you the whole time as a circulating nurse, but you may not see me because you will be behind the drapes. So you'll see Drew, but I'm still here the whole time. And then once you leave the OR, then we go back to the labor room where we're going to recover for several hours before you go over to postpartum. And usually I will be your recovery nurse as well. During that recovery period, we'll do the same things we do after a vaginal delivery. We monitor your bleeding, get your pain controlled well, and make sure you're breastfeeding and bonding with your baby. And I can't think of much else. Is there anything else?
Who else could you see back here in a C-section?
Yes, you're also going to see a scrub tech that's going to be helping the physician. We're going to have a nursery nurse come in and assess the baby. So as soon as the baby's born, the doctor will hand the baby off to the nursery nurse. And as long as everything's going well with the baby, then they'll show you the baby and run up close. And then they'll take the baby just across the room here to a warmer where they will assess the baby and do footprints, weights, measurements, that kind of thing. Also, your significant other or a person that you choose usually can come back with you as long as it's not an emergency situation. Usually what we do when we bring you back is you'll come back with just the nurse and the anesthesiologist or the CRNA, and we will bring you back first and get your spinal put in. Then we will prep you, get your drapes on, and then we will have the physician come in and they will test and make sure everything's going well with your spinal before we go and get your person that you're going to have come back with you. That's just for the safety of everybody and for the safety of yourself. So that person will come back around the time that they're getting started, but be here before the delivery.
So what happens if the spinal is not an effective form of anesthesia?
Well, the surgeon will check adequate anesthesia, and if it's not working, then we have several options. There's just some IV medications that we could use that can keep you comfortable throughout, and then you always have the option to go all the way to sleep, where we would place a breathing tube, use anesthetic gas, just like a normal surgery, and that'll keep you asleep and then wake you up right afterwards. You can kind of delay your wake-up time and when you get to hold your baby, but if that's an option and a route that we need to go down, then we have that.
So, Dr. Christian, what can they expect to find once they're once they're in recovery and actually looking at their incision site? What can they expect to find there?
Well, usually following surgery, your incision will be covered with a bandage, and depending on what type of bandage is used, oftentimes that will stay on for at least 24 hours, sometimes longer. There are situations where we use a silver impregnated bandage, which can be left on for a full week, and depending on the type of closure that your surgeon uses, sometimes you'll come into the office a week later and have staples taken out or have the incision assessed in other ways, but the type of bandage used will determine how long it's left on. And then there's some benefits to different types of bandages.
What about what will the patient and whoever they bring back with them wear when they're in the OR?
Right, so the patient will wear the regular hospital gown, and we're gonna put a hat like this anytime you come to the OR. So you'll have a hat for you, that's the patient. The person that's gonna come back with you, we're gonna provide you a pair of paper scrubs to wear, to put on over your clothes. And you're gonna have shoe covers and a hat and a mask as well. You'll have to have all those things on before you enter the OR.
And Rebecca, how do you help the mom when she's in recovery with breastfeeding?
We do like the baby to try to nurse within the first hour. So once you get into recovery, we're gonna put a few monitors on you and make sure you're good. And then the first thing we like to do is try to do some skin to skin if that's something that you would like. And we can assist you with breastfeeding a couple different ways. It's a little difficult right away because most of the time you have to you can't sit straight up right after a C-section, just due to the anesthesia and things like that. So we'll be able to help you by providing pillows and help position the baby. The nurse also will be in there to assess your baby very frequently, and she can come in and assist as well.
What can a patient expect for recovery time after a C-section?
One other benefit, if I may just attach to your comments about the breastfeeding immediately following surgery, in addition to helping with the mother-baby bonding and also the nutritional benefits of breastfeeding, getting that early colostrum from breastfeeding. There's also a medical benefit to breastfeeding soon after you deliver, in that the nipple stimulation causes the uterus to contract, and that uterine contraction is what helps keep you from having bleeding following a C-section. So I think that's another added benefit that most people don't think about, in addition to all the other wonderful benefits to breastfeeding. And I'm sorry, Celine, what was the question?
What can a mom after a C-section, what can she expect as far as recovery time? How long it takes to recover, the guidelines that she should follow when taking care of herself, those kinds of things.
The recovery is somewhat patient dependent, and also I find that the experience patients have following their first C-section is a little different than when they have a repeat. And I think that's oftentimes because they know more what to expect when they're having a repeat C-section. But generally, that first day, you're in bed, but that first postpartum day, the first post-op day, we like to get you up walking around the nurse's station at least. Getting you up ambulating is really important from a number of medical factors. I think it also makes you feel better. Being up and about helps get your bowels moving and you don't feel so bloated. There's a lot of fluid that we administer during the labor process, whether it's vaginal or C-section, and I think getting you mobile helps mobilize those fluids as well. And it's one of those things where every day it seems to get a little bit better and a little bit better, and usually by 2 weeks out, you're feeling totally human again. So I think that's the basics of that.
Patients ask all the time, what's the difference between the epidural you get when you're in labor and then versus a spinal when you get with a C-section, or if you start in labor and you end up in here, what's the difference?
So for labor, we would use an epidural. This is just gonna, I would say, help with the pain versus a spinal, which will make you completely numb. With the epidural, you still have the ability to push, feel contractions and timing and that kind of thing, but like I said, with the spinal, you're completely numb from about here down. You'll feel some pushing on you, some pressure still, which can be slightly uncomfortable, but you're not going to feel any sharp pain, anything like that from the surgery. If you start in labor with an epidural and you fail to progress, or for any reason we need to come back here, we can still use the epidural in place. We just use different medicines that will make you numb. But again, you still feel some pressure, some pushing, that kind of thing, but we can use either option.
So what about if we were to have like a multiple delivery, say twins, what times we deliver in that OR, what's the reason for it? How does that change things back here? What's the rationale for doing that?
The reason for delivering in the OR.
For twins.
In the labor room.
Well, I could talk for an hour just on
Just a brief.
on that. The biggest thing is with almost everything in pregnancy, with multiple gestation, any risks that you have in pregnancy are increased with multiples, and that is true for so many different things. But one of the, in terms of acutely with a delivery situation, there's always many more people in the room, and you also will do that in an environment like this because depending on different factors that can arise during the delivery, you may need to proceed with C-section. Perhaps you were trying a situation where you had the first baby was presenting with head down, and the second baby was going to be presented breech, and if you try to breach the traction and weren't able to do that, you can convert to a cesarean section much more quickly in an operative environment like this. There are numerous different situations that you have to be prepared for with multiple gestations, and being in an environment like this helps you pivot in those situations should you need to.
For twins, we also bring in an extra warmer into the room, so we're able to keep both of the babies in the room with you as well. We don't have to move out to a different room. And something I meant to mention a little bit ago was that we do try to keep the baby in the OR with you the whole time. And once the baby is done with her, the nursery nurse is done with her assessment, they bring the baby over to you. We can attempt to do skin to skin if that's something you want to desire. It's a little difficult with the drapes and stuff, but we can get it done. And also the father or whoever's with you can hold the baby, show the baby to you. We can help, you can get a few pictures. It is okay to bring your camera back to take pictures after the baby's born. And we try to keep the baby in the room as long as everything's going well until you exit the room as well when you go to the recovery room.
So one more question about epidurals and spinals. What are some of the things that can happen after they've had that? There's a lot of myths, there's a lot of controversy about having spinal and epidural anesthesia. So what are some things that could possibly happen and how do you take care of it?
One thing that's pretty common is low blood pressure. But we have medications that we can immediately treat. You're monitored the entire time and post-op your blood pressure, so we'll be on top of that. Definitely still safe to do. Sometimes that can cause nausea, but it's just secondary to your blood pressure dropping quickly. But we have medicines that can treat it immediately, and we'll be on top of that.
What about the head?
Sometimes, whether it be from the pressure dropping, it changes or some of the medications we use. They put a lot of pressure on you, getting the baby out, and a lot of times that can cause you to experience a headache during the procedure, or maybe even like I've had before patients say there's chest tightness, and we start thinking heart, but really it's a lot of it's just pressure being pushed on that can cause these feelings. Spinal headache. It's pretty rare, but when we go into your spinal canal, we pierce the protection and some of the fluid can leak out. More than we're wanting, this can cause a headache. It can be treated. We just go in there similar to how we put the spinal in. We do what's called a blood patch. This should take care of it, pretty quickly. You have to lay flat for some time, but can be treated also.
Do you ever have situations back here where you do a combined spinal epidural?
Some do. I haven't done any here, but you do have that option if your epidural is not adequate, or we don't think it's going to be, or we have the option to kind of come back and do the spinal with that as well.
Can you do delayed cord clamping when you're having a C-section?
Yes, and almost always do.
Okay, Rebecca, you want to talk about the clear drape?
Yes, we have a drape. Do we have one to show?
We're going to show them.
Okay, we do have a drape that is clear. It's clear from like here up. Is that correct? And so usually when we have you laying on the table, we're going to put a drape up, and it makes it to where you can't see below. So we have a clear drape so that you're able to kind of see what's going on. You're able to see the baby be born. And that's pretty interesting. So if that is something you want, be sure to talk to us about it beforehand. That way we can get it out and have it ready for you.
What percentage of patients are opting to watch here at this location?
I think if more patients knew about it, we'd have a lot more.
Yeah.
But only the ones that are asking for the drape, they don't know that we have them. So that's one reason we were wanting to talk about it. I think that there would be a lot, because a lot of my patients have that.
In talking to my patients, when I bring that up, sometimes they're like, oh,
Yes,
no, I don't want to watch, or like, yes, that would be great. And so it's always interesting to see what percentage.
It's not telling them they can see, but, you know.
yeah, a lot of people, I actually haven't been in this position, but they say that you can see reflection up in the spotlights, and so a lot of people actually are laying here and watching their C-section in the spotlight as it's happening. So that's interesting for you, and feel free to do that.
So can y'all think of anything else that you think would be important to share with them?
If you are in labor and your baby does start having lots of issues and they think that, you know, you might have to have a C-section, be aware that there may be several nurses coming at once to help you get ready. Try not to get scared or nervous about that, but we work together and we want to get you ready as quickly as possible so that we can have a safe delivery. So if a bunch of people come in your room when things like that are happening, try to stay calm as possible, understanding it's scary, but we are just trying to work as quickly and efficiently as possible.
I'd just like to say that at this location, at CHRISTUS Good Shepherd, they have an amazing nursing staff, and the nursing staff here works so well with the nurse midwives and the physicians and the midwives work really well together. It's such a happy collegial place to work, and it's a fantastic place to have a baby. And the fact that CHRISTUS Good Shepherd is going through the effort and expense of having a 24-hour obstetric emergency department is such a great thing for this community, and it really adds a special element to the care that you will receive here at this hospital.
So now we're kind of finished the discussion. If anybody has any questions, I'll be glad to take questions. And then we're also going to use Jacqueline as our model. She's going to actually lay on the surgical table, and we're going to put one of the clear drapes over her so you can see how it works. And then Drew is going to talk about things that happen behind that drape, like why are your arms having to be out beside you and things like that. So are there any questions? Okay, so y'all, you can step away if you want to. You will go.
All right, y'all. So this is not a fake belly. This is real.
This is how you'll sit for the spinal also.
Yes.
Come and sit just like this, and I'll be behind you.
We went through this kind of, I think it was the last video we did. We showed you in the labor room how you're going to sit for your epidural. It's going to be the exact same thing for the spinal. Now, again, if you already have an epidural in place, let's say you were in labor and they decided, you know, we need to proceed with a C-section, they're going to actually dose your medication in the room through the epidural. And then you're going to come back here and they're going to transfer you to this OR table. If that doesn't work, that's when we would proceed with trying to do IV medications or possibly even putting you to sleep. But if you come in and the C-section has already been decided, this is your repeat C-section, or maybe it's your first section, but you know there's something going on with the pregnancy where you and the physician have decided this is the best option, they're going to bring you back in here and they're going to set you up on this table. Right, or, I'm sorry, correct. So Rebecca reminded me, if you're in labor and you haven't had an epidural yet, you would also be brought back in here and set on the table just like this. Your nurse is going to help put you in this position and she's going to talk you through what you need to do. So don't worry about that. We just want to kind of show you what you would expect. Okay. So after the epidural, we're going to do the spinal, right? Okay. So now we're going to show you kind of what it's going to look like to be draped. You're going to be numb, so they're going to be doing this for you, okay?
Where's the bridge?
No, they're I really want to
So you won't lie flat. They're going to put a little wedge under your bottom, just like this, because they always want you off your uterus. Your uterus is very heavy, so they're going to put a little wedge under your bottom, and then they're going to put your arms out to the side,
on the arm board, just like this right here.
So they're gonna probably even put a little strap on your wrist just to help you to remember not to move. It's not gonna be super tight or anything, but it's just gonna help you to remind you.
And not to reach up there or
Not
so
to
it doesn't
reach or
fall
grab.
off.
Mhm.
Sometimes when you're in this position, you get a little anxious and you don't mean to reach up, but, so we just help you with reminding you there.
And your partner can be here to hold your hands.
Yes.
for it to sit.
Okay, can you, I don't know if we can see this. Maybe, yeah. I don't know.
Maybe from
Up here, back there. Back up here, yeah. So this is the area where we're doing the actual C-section, but here's the little window for the clear, so you can actually see what's going on. I don't know if they can see that. Can you see? Oh, you can see Jacqueline.
get closer.
Yeah, that's good. That's
That's a
good.
little window right here. I can see. Not too much though, which is good.
Yeah, that's good. You can't see too much.
This
But-
is where the incision would be, this area.
Can you show again?
This would be, the incision would be right here in this area. We're not taking this apart.
Good. No, you can't even see it. There you go.
It would be right here.
And then your partner's gonna be back here with me.
Right back here.
I'll be the partner.
Right back here, behind the drapes. We have a stool for them to sit down, and we ask them to not reach over the drapes. And then once the baby's born, the support person's able to come over here to the warmer and see the baby and take some pictures as well.
Okay, swing it around and see if you can get the warmer in there.
Is this the right angle, Rebecca?
Yes, that's good, right there. The warmer, at first glance, looks like it's wide open and everybody's a little worried the baby's gonna get cold, but this is the heating device up here that's gonna keep the baby nice and warm. This is where the nurse will do her assessment on the baby and weight and measurements, things like that. So it's just right here by you.
So I'm talking to ask some questions and just wrap it up.
Okay.
Wait, I have one of these.
Oh, sorry.
Hi guys, just wanted to reiterate that if you are going to have a midwife delivery and it turns into a C-section, or you're a patient that is a planned cesarean, then the midwives will actually first assist or help with the surgery and get you ready and all that stuff with the doctor. So you're not just given to someone you don't know. We're there through the whole thing. Just wanted to reassure you of that.
Hi ladies, it's Natasha again. Glad that you joined us today. Just a quick thing that I wanted to go over in light of our pandemic and COVID all around us. So at this time, we are able to allow one visitor to come in with you if you were to have a C-section in the operating room. And we are allowing visitors at the bedside, one at a time, that's able to exchange out right now. And so we just want to remind you that as things evolve, that may change, but we'll try to keep you updated as well as your providers in the office so that you know what the current recommendations are. At this time, we would entertain any questions that you might have before we wrap up. All right, not seeing any questions in our chat box. If you weren't able to join us at the beginning, we are working very hard to put these recordings on our CHRISTUS Good Shepherd website so that you can catch the beginning as well as any previous recordings. So we thank you again for joining us. We look forward to next week. Next week, we have even more exciting information to go over for you that's related to your baby, what types of screenings we have to do that are required, what happens with your baby when they go to the nursery, what the birth certificate process is like. So we have lots of information for you next week. Same time, same place. We look forward to seeing you and hope you have a great week and stay safe. Thank you.